Good evening, everybody, and thank you for joining tonight's Q&A webinar with the fund staff. We're really looking forward to engaging with everyone here tonight. My name is Joe Obahowitz. I'm the fund director here at the Eastern Atlantic States Carpenters Benefit Funds. To my right, I have with me Eric Scheckler. Eric's our retirement department manager. To the right of Eric is Heather Hatch. Heather is our medical department supervisor. And to the right of Heather on the panel tonight is Dave Latuchko. Dave's our collections manager. Collectively, we have approximately 70 years of benefit fund experience up here. So we are, as I mentioned, excited to engage with the membership, hopefully answer any questions that you may have. With that being said, before we get kicked off, just some quick housekeeping items. As far as submitting the questions, we did send out an email earlier, a couple hours ago, with just an update and reminder about tonight's webinar with information on how you submit the questions. It's very simple. Just look on if you're using a mobile app or on your desktop, just look for the chat button and click on that, and you can type your questions in there. They're going to be monitored on the back end. They'll be fed to me, and I will ask the questions to either myself or the panel. With that being said, as far as the questions go, we'd like to keep the questions very general. At this time, we don't want to be airing somebody's personal information in a public forum. However, so if your questions are a little too personal, we think we will flag them, and somebody from the fund office will get back to you tomorrow. So even if you just want to send a personal question, we can then still look at it, determine whether or not it's correct for this type of forum or not. But regardless, somebody from the fund office will get back to you tomorrow. With that being said, please start sending your questions in. And we're going to get started real quick. A lot of the questions panel that we're going to be discussing and the membership who's watching at home, a lot of the information that we're going to talk about tonight is on our website, the carpenters.fund website. I think our communications team does a great job of sort of pushing out that information, but you do have that information at your fingertips that you can review at any time. One of the most important aspects, we believe, of the website is the My Profile section, to where it really gets into your personal information that we house here at the fund office. And I'm going to turn it over to Dave Latuchko, and Dave's going to give you kind of an overview of your profile and what you can expect and how you log in. Dave, can you take it from there, please?
Absolutely. Thanks, Joe. As Joe mentioned, the My Profile, which can be found on our website, very easy to remember, carpenters.fund, carpenters.fund. Just click participant website, and My Profile is the first tile that you'll see there. Many of you, I'm sure, have logged in there. If you have not, please take a moment, visit that website, click on My Profile, and log in. Again, if it's your first time, you may not have the login information. You can self-register and be able to get in there under your own profile. Once you log in, you'll see your name right there. You'll see all of your demographic information, your date of birth, your address, your phone number, your email address. Make sure all of that is up to date and current. To the right of that, you'll see your eligibility information, whether you're eligible for health benefits and what period you're eligible for. Then under that, you will see some information pertaining to your pension or retirement benefits, how many years of service you have, your accrued benefit, and whether you're vested or not. And then after that, you'll see your work history. This is a screen that shows all of the hours that have been reported by the employers that you worked for. I'm sure throughout the years you've contacted the benefit fund office and asked about whether a certain employer that you worked for has paid your hours. When we look at those screens, we see that exact same screen that's available to you under My Profile. So make sure you're checking that regularly, saving your pay stubs, and reviewing that every employer that you work for is reporting your hours and your wages accurately. On the left-hand side, you'll see some other menus, contributions by fund. You're able to check your beneficiary. If any hours are missing, you're able to submit a hours discrepancy review. And there's just a lot of very good information available to every single carpenter. Wonderful resource. Please check it out and make a habit of doing so.
Yeah, good stuff, Dave. Just a quick follow-up to that. If a member has any issues with logging in, who would they contact?
If you have any issues logging in, you can contact the benefit fund office. The number is right there on carpenters.fund. Collections department is extension 4. You're also able to chat. Again, during normal business hours, that's not a computer you're talking to. That's a live person you're able to chat. or email us, collections@carpenters.fund. Again, we're here to serve you and to help you get in and to see all that
Yep.
information.
And another thing we like to just promote on the my profile page is that it's accessible 24/7. So, if you're just having insomnia at night, want to know what your annuity account balance is, or whether or not you're going to be eligible for next benefit period, or you're missing hours, you can check it in real time right then and there. So, all right, we're getting some questions coming in here. So thank you, Dave, for that. This is going to be for Eric. It has to do with retiree healthcare coverage. The member's asking, he has 25 good years with 14 broken years in between. Would he be eligible for lifetime medical? So I'll set that question up as, what are the qualifications, Eric, for retiree medical coverage?
To qualify, depending on which legacy fund you came from. So a Philadelphia legacy participant needs a minimum of 25 years, does not have to be consecutive for Class 2 coverage, or 30 years for Class 1 coverage. And a legacy Northeast Carpenter Fund participant, depending on when you were indentured and your first hours came in, if it's prior to 2013, you need 25 years, or after 2013, you need 30 years. They do not have to be consecutive.
Okay. Thank you, Eric. Good stuff. We got some other questions coming in. And this is from Carly. Carly and Heather, I'm going to turn this one over to you. Is there financial assistance for out-of-network therapists besides the HRA or switching therapists?
So unfortunately, we have a lot of options for, I'm assuming this is for a mental health therapist. For those therapists, you do want to contact mental health consultants. They do have options to possibly sign a single case agreement with that provider. So possibly you can continue to still have services with that provider. Otherwise, they can also help you find a provider that is in network.
Yeah. So again, Heather, just to reiterate, if you have a therapist, assuming it's a mental health therapist, that's out of network, we can try to engage with mental health consultants to get them in network.
Correct. Even if it's a single case agreement.
Single case agreement. Yep. Okay. Thank you very much. Here's another one from, here's a Steve. Heather, I'm going to stick with you. Can my spouse be covered under my health plan if their employer offers healthcare coverage?
So yes, your spouse can be covered with us. The plan does state that your spouse does have to take their employer-sponsored health insurance, but the fund will act as a secondary insurance payer.
Okay. Thank you. Thank you for that. We have one from James, and I'm going to turn this over to Eric. Do you think it's best for me to take 100% joint survivorship and get an insurance policy for my pension for my spouse?
It's a good question. Unfortunately, I'm not able to answer that. That would be something you would want to hire, maybe visit with a financial advisor to go over your options. I really can't lead you either way what to do. That's a more personal question and something that someone's more professional in the financial planning would be able to better assist you in.
Yeah, and Eric, just to follow up with that, we do offer retirement awareness webinars. Yep. If you haven't checked them out, they are on our YouTube channel. The second part of that retirement awareness was our stressing to the membership, and correct me if I'm wrong, to how important it is to meet with a financial advisor. All right, and we introduce you to financial advisors. Just full transparency, we don't endorse them, but we do encourage you to meet with financial advisors, and that's something you should have a conversation with the financial advisors about, to find out if that is your best course of action as far as coming in here and picking those options. Because again, that's not something the fund office can recommend to you. That's a decision that you and your spouse need to make. And, if you have a financial advisor on your own. All right, let's get the next one. This is from Michael. Heather, I'm going to stick with you. When you add dental coverage, is the $2,500 limit for each person or both combined?
So that one could be if you are a retired participant. The Legacy New Jersey, it is an additional fee that the member and spouse can both enroll in their own dental plan. For the active membership, it is a $2,500 family allowance.
Okay. Thank you very much. I got a question here. I'm going to turn it over to Dave now regarding vacation. When do the vacation payments get paid out?
Sure. So the vacation payments get paid out once a month if you're signed up for direct deposit, and that's usually on or around the second Monday of the month. If you're not signed up for direct deposit, those go out via paper check one time a year, and that's in January. So again, direct deposit monthly, check annually.
Okay. And what, Dave, just to follow up to that, what is made up of those contributions get paid out monthly?
Okay. So the next payment that's going to be going out is in May, and that's going to pay out everything that was received in the month of April. So that might have been work hours from February or from March. As long as it was paid between April 1st and April 30th, it's going to get paid out in that May distribution. And so it is for that. Every single month, it gets the month prior to gets paid out.
Okay. Thank you, Dave. I have a question here regarding Class 1 and Class 2 coverage, Eric. What is the difference between Class 1 and Class 2 coverage from a retiree health coverage standpoint?
Okay, so the biggest difference is, well, copays. Coverage under Class 1 and Class 2 is completely the same. Under Class 1 is that's you hit the 60 benefit periods or 30 years of coverage while you're active. You retire Class 1 coverage, you'll get the full benefits. It's at the lower copay per participant, per spouse, and then per dependents. And then it's depending on your age, the copays are lower. For Class 2, the copays go up to $250 per participant, per spouse, and per dependents. Once again, depending on your age.
Okay. Thank you very much, Eric. Eric or Heather, I'm going to turn it over to you. We're getting some questions regarding the HRA. What can the HRA be used for?
So the HRA is for any out-of-pocket medical expenses you may have. That can include your dental, prescriptions. For that, you can visit our website. There is a link to the HSA store. On there, you can actually purchase things right from there. And as well, they have a full list of anything that is eligible for the HRA.
Okay. We had a question coming in from a Doug, and he's asking if a medical bill goes to collections, is he able to use that to pay off his is he allowed to use his HRA to pay that off?
So we'll honor any visit within 1 year from the date of service.
As long as it's 1 year from
1
date
year
of
from the
service,
date
you
of
can do that.
service.
All right, correct. Good job. And if a member loses his HRA card or his or her HRA card, how would they go about ordering a new one?
You can just contact us here at the fund office and we can order you a card. There is a $5 fee that does come directly off your HRA balance.
Okay, thank you very much. We're getting some questions about beneficiaries. I'm going to turn it over to Heather and Eric now to talk about the difference as far as beneficiaries from a health standpoint and the retirement standpoint. But I want to stress how important it is, and Heather, you can take lead on this, how important it is to make sure you have the most recent updated beneficiary information on file.
Absolutely. After every life-changing event, a marriage, a new child, a divorce, you definitely want to call us and get a new beneficiary form so we can mail that out to you. We have had occasions where beneficiaries have not been updated in quite some time, and you definitely want to make sure you have the most recent beneficiary you want to leave your benefits to on file.
Okay. Eric, anything you want to add to that?
Yeah, I would just say make sure you update them. If there's ever a chance that you never filled one out since you were brought into the funds back when you were like 19, 20 years old, if some benefits don't legally go to your spouse automatically. So if there's a different beneficiary other than your spouse, there could be some payouts that you were expecting that may not go to the spouse.
Correct. And Heather and Eric can back me up on this. We've seen that one too many times within the fund office. That's a legal document that's signed that's going to be the rightful owner of that money. So if you ever have a life-changing event, you should, obviously make sure that you update your beneficiary. And Dave, that's something you can check on My Profile, correct?
Exactly. Right there on the left-hand side, you'll see beneficiary, and you'll see all the funds and all the beneficiary information pertaining to those funds.
Okay. Heather, I'm getting a question in here from Charles asking how many physical therapy sessions are allowed under our coverage?
You are allowed 30 physical therapy sessions per plan year.
Okay. Are you allowed to go over that at any point?
If you do need additional visits, you can contact us here at the fund office, and then we can evaluate from there.
Yep. All right. So if I need 40, say, and I exhausted my 30, you just contact the fund office. We can contact independents, get them in touch with your provider, and see if those additional 10 are needed, and make like an override to get that.
Correct.
Make sure it's medical necessary.
Yes,
correct.
that's something medical
Okay.
necessary.
Eric, this is a question that's coming in as far as withdrawing money from the annuity. Can you kind of go over the difference maybe a loan or a hardship, and are loans allowed? Let's just
Sure.
start there.
Sure. Loans are allowed, but only on the EAS annuity money purchase plan subgroup. And that's all former Northeast Carpenter Fund participants who had contributions prior to 2009. Loans function the same way as a hardship. It's just that you'd have to pay the money back over a certain period of time. And then at a set interest rate, which is the prime rate +1, which currently is 8.5%. Whereas hardships, you can take a hardship from the profit sharing account, which is all your current contributions, and they are, it's limited to 50% of your balance up to $50,000, and it's going to be for purchase of a home, saving your home from foreclosure or eviction, tuition reimbursement for post-secondary education, outstanding medical expenses, and funeral expenses for immediate family members.
Yep. And there's a lot of information, as
Right.
again, we're going to sort of point you to the website about the hardship provisions. The Philadelphia Legacy Annuity.
Now, under Philadelphia Legacy Annuity, the only time you're allowed to withdraw from that is retirement, death, or you cease working in the fund, in the
Separation from
trade,
service,
separation
right?
for service for 24 consecutive months.
24 consecutive months. So
Yeah.
just to follow up, there are loans available, but it's under the old Northeast
Money
account,
purchase
money
plan.
purchase
Yep.
plan. And then, but there are hardship options under
Hardship
the
options.
new
Profit sharing.
profit sharing plan. Okay, thank you. And again, all that information can be found on the website for those qualifications. Heather, written some questions, and you touched upon mental health consultants, about who is mental health consultants, and how can they help a family that maybe needs those services. And then do we offer any type of peer support that follows along with that, and somebody needs that extra care?
So mental health consultants is our mental health vendor. They do have a network of providers that you're able to see for therapy, counseling. There are services out there for anybody, your child, your spouse, yourself. We also do we do have a benefit with Manifesto for the peer support. So if you are in need and you don't want to go through mental health consultants, if you are in need of substance abuse or alcohol, you can contact Manifesto and they'll be able to help you as well.
Okay. Another follow-up question, and this is a follow-up question to the member who had the question about his spouse and has the employer that has healthcare coverage. How would he go about adding his spouse to our coverage? And a follow-up to that, just if somebody has a life change where they have a baby or get married, what's the best way to get their dependents added to our coverage?
So you can either log onto our website. There is a secure upload center. We would just need copies of the birth certificates, social security cards. For a spouse, we will need a marriage certificate. If the dependent has any other health insurance, you would want to send us a copy of those cards as well. You can also email us at enrollment@carpenters.fund. We take about 5 business days to process everything.
Okay, so it's fairly easy, right?
Yes.
It's the easiest thing to do is just upload it on the website.
Absolutely.
And typically, do we send confirmation that it was received?
So you do receive an email back that we have received documentation.
Yep. So if you don't get that documentation back that we received, it would probably be a good idea to call.
Just give us a call. Yep.
Yep. Eric, will be a question for you. For some reason, someone does not make eligibility for retiree healthcare coverage. Are they allowed to buy into it?
At this time, you're not allowed to buy into it. However, if you are active at retirement, we will cover you for the remainder of that benefit period before you'll be eligible for COBRA.
Yep. So that they'll be able to exhaust the benefits that they
Benefits.
did earn, and then unfortunately they would be on their own. But there is no buying up.
There is no.
When it comes to that, unfortunately. Okay, I'm getting a lot of good questions coming in here right now. Eric, we talked about joint and survivorships, where a member had a question about 100%. What options are there when somebody comes in to retire to leave in the event that they're married? What options would they have to leave something for their spouse in the event that something
Sure.
happened to them?
If you're a married participant at time of marriage, you have 3 options for joint survivors. You have the 50% joint survivor, there's a 75% joint survivor, and the 100% joint survivor. All 3 options come at a slight cost. It all depends on your age at retirement and the age difference between you and your spouse at retirement. And then, as the name say, they'll get 50% of whatever you're receiving or 75% or 100% what you're receiving at the time of your passing. Now, for the 100% joint survivor, if you work until age 65 or are active after age 62 but wait to retire until 65, you will get the 100% joint survivor at no cost.
No reduction, right?
At no reduction.
Yeah. So there is an
So
incentive,
there's an incentive
to wait if you want to, if you choose to do that. And again, those are personal decisions that the member and the spouse have to make on their own. And again, that's why we try to make sure that retirement planning is key and that you're prepared when you come in to retire. I got a question from Tom. If I was asking when I can receive my full pension, and what's the difference between the legacy pension and the VPP? And would my pension change after I retire if I had a VPP? So maybe let me back up just so I can help clarify this question. Maybe it's a good idea, Eric, if you can explain the difference between the legacy pension and then the variable pension plan.
Sure. We'll start there. Legacy pension is everything you earned prior to the merger for Legacy Philadelphia. So anything prior to 1/1/2023. And for former Northeast Carpenter pension participants, it's anything earned prior to January 1st, 2022. Now for the VPP is everything after those dates that you earned. So for January 2022 for Northeast Carpenters is when you start the VPP, and 1/1/2023 for the former Philadelphia participants. Now the legacy plan, your benefit doesn't change once in retirement. Once you're locked in at that figure. The VPP, however, will get adjusted based on the market rate and whether or not it exceeds our hurdle or break-even point. Right now, our break-even point is 5%. So anytime the rate is higher than 5%, your accrual will change based on that percentage. And anything under 5%, it will go down. It does go down in retirement, not just while you're accruing benefits, but in retirement, it will also go down.
Hopefully not.
Hopefully not.
Hopefully not. But I guess there is potential that, and right now it's just a small portion of your benefit, but
Right.
it also has a chance of increasing also.
Correct.
Which is
Yep.
good.
Now, the second part of that question is when to retire.
Yep.
There's a lot of different variables. Per the plan, you can retire at age 55. If you do not have 30 years of service, you'll be subject to early reduction. For active participants, you'll be subject to early reductions. It's 3% per year between your age at retirement and 62. Special early retirement at 62, if you're active, there's no reduction. So that becomes like a special normal rate. And then at 65, that's your normal retirement date. There'd be no reduction after that.
Okay. Dave, I got a question for you. I got a member who thinks he's missing hours from the early 2000s. What would he do?
Definitely reach out to us. Either call us, the collections department, extension 4, or email us, collections@carpenters.fund. If you have pay stubs, time periods, the employer name, address, all of that will be helpful. The rule of collections is this: the longer you wait, the more difficult it becomes to collect those hours. Again, if it's from decades ago, the company could be out of business. The employer or the owner could be deceased. However, we will do everything in our power to collect those hours. We're going to try calling, we're going to try arbitrating or legal action, whatever it takes to collect those hours. However, I would encourage every single person listening to try and not put yourself in that situation. Check your hours at the very minimum once a year and let us know sooner. Again, the longer you wait, the more difficult it becomes. However, please let us know if you think you're missing something from the early 2000s or from the 90s. We're going to do everything we can to collect that and to make sure you receive those hours. So just let us know.
Okay. Thank you, Dave. I'm getting a question where a member is going through a divorce. What would he need? What would the fund need from him in order to, I guess, remove his spouse from our benefits? Heather, I'll start with you first.
So you would want to submit your divorce decree. We will also need a copy of your property settlement agreement. We will share that with the pension department. Once we receive that, we will mail you out a new beneficiary form. The divorce decree will remove your spouse from benefits at the end of the month that the divorce is finalized. And then you can submit your new beneficiary form to us and remove your spouse from benefits, from your beneficiary benefits.
Okay. Eric, you want to add anything to that?
Yeah, I would like to add on the retirement side, you really want to get the property settlement agreement or marital settlement agreement in as soon as possible. And if there is a need for a domestic relations order, to get that out of the way right away. If you wait until you're ready to retire to do that, it's going to delay your retirement, because the domestic relations order can take months with attorneys and negotiations and everything else. And then we have to approve it, and then it gets to go back to the court, and then comes back again. And then we have to send it to an actuary to do the calculations, which takes takes more than 90 days in some instances.
Yep.
To get the calculation back. So it's really important that you try and get that stuff taken care of right away.
Yeah, and just to reiterate, unfortunately, Heather, what happens if you don't notify us that you're divorced and your spouse continues to use the benefits?
So
Or your ex-spouse, excuse me, yeah.
You should send in your divorce decree within 60 days after that final judgment. If your spouse does continue to use the benefits after your divorce, unfortunately, you will be responsible for returning those funds back to the fund. So any claims that the fund has paid, you will be responsible to pay back to the fund.
Yep. So it's very important, just to reiterate, if you are going through a divorce, you can let the fund know that you're going through a divorce, which is helpful. But once you get that paper signed, you make sure you send a copy in here along with the property settlement agreement. So we make sure that there's no curveballs or wrenches that are going to deter you from retiring when you want to retire. Eric, just to follow up to that, assuming everything's clean and I just want to get retire and I know what my target retirement date is going to be, when should they contact the fund office for their paperwork or come in for a meeting?
Good question. Now, if you're a single participant or married with no divorces, I would call at least anywhere from 45 to 60 days prior to your intended commencement date. If you are previously divorced, I would call at least 90 to 120 days prior, only because we have to send the calculations out to an actuary to do the calculations, and that takes 90 days minimum.
Okay. All right. Thank you, Eric. I'm getting a question here from Kyle. How many years of reduction would it be if I retired at 55 and I only had 21 years of service?
Depending on
Assuming you're active.
Assuming you're active, and depending on which legacy plan you're in.
Okay.
If you're a former Philadelphia participant, it'll be 3% per year from date of retirement to age 62. So if you go out at the month after following your 55th birthday, it'd be 21%.
21% reduction, yep.
On the Northeast Carpenter side, there's different milestones from the different mergers. So it varies anywhere from 4% per year from date of retirement to 62. And the older years, it's 4% to 60.
Yep.
So
The point being is, and just to back Eric up on this, because of a lot of mergers that we went through, there is sort of grandfathering rules that are in effect. So I think the best option, if you have certain questions, there's follow-up questions that we need, whether or not what plan you come from. So I think it's best to just contact the retirement department, and we can go through those numbers with you, right? And they can contact the retirement department at any time to kind of go over those numbers. We can do it over the phone, or Eric, they can stop in the office or make an appointment to just come in and look at their numbers, correct?
Yeah, correct. And on the website, on My Profile, they can download their pension statements.
Yep. With
different dates. They can put different dates in the future to see what the impact would be to their pension.
Same thing with the annuity.
Same thing with the annuity.
Yep. All right. Thank you. After I start collecting, member question came in from Mario. After a member elects their joint and survivorship and starts their pension, can they change it?
No. Once you receive your first pension check, you cannot make any changes to your selection of benefit options.
It's just
you're locked in.
Correct. Yeah.
Yep.
Now,
even if there's a post-retirement divorce, they stay on as the joint survivor, even though you're no longer married.
What happens if your spouse predeceases you and you elected one of the joint survivorships?
If you elected one of the joint survivors who predeceased you and you were active at retirement, your benefits will pop up to the full accrual rate.
Okay. Thank you. We're getting a lot of
once you notify us.
Yep. Once you notify us. Correct. Yeah. We're getting a lot of retirement questions. So I'm going to shift gears here and go to some health questions, and we're going to focus on Heather now. Heather, I lost my insurance cards. What do I do?
You can contact us here at the fund office. We can order your medical card, which is through independent administrators. We can order your prescription card for Express Scripts. Davis Vision, that is along with your Independence Administrator's card. The only card that unfortunately we cannot order is your Cigna card. So you can contact us here. We can give you the phone number. All those cards are available on the vendor's portals to download and add to your Apple Wallet.
Okay,
You have
so
the
that,
app.
that seems to be the best option now.
Absolutely.
And no one really likes to carry cards anymore. You can take a picture of it too. That's what
Absolutely.
I do for me and my kids and my family. Heather, to follow up on sticking with that, as far as does the fund offer any type of disability, workers' comp, or short-term or long-term disability benefits? And I'll
So-
start with you first. I think there's a retirement aspect to that too.
So I'll start with workers' comp, then we can transition to disability. So there is a workers' comp benefit. So if you are currently out on workers' comp, you want to notify us immediately. We do have, the benefit does give you 30 hours of credited hours towards your health fund benefits and your pension benefits. For disability, there is a monetary amount that is available that is provided that you're not collecting New Jersey state disability. With that, you're also given 30 hours a week credited hours to your health fund and your pension fund, and you're allowed to be on the disability benefit for up to 2 years as long as your doctor keeps you from returning to work.
Okay, before you go there, Eric, before you chime in as far as how it impacts the retirement side of things, can I collect unemployment and the fund's disability?
You cannot.
Okay, yeah, that's a big no-no, correct?
That
You
is
can't
correct.
do that.
You can't.
All right, and that's a part of the questionnaire and everything you got to
Absolutely.
sign. Eric, how does the credit hours impact the pension?
So when you receive the credited hours from the health side, it does keep you active in the pension plan to earn credited service. You don't earn an accrual with that, but you will at least it will keep you active in the pension plan with the credited service towards your overall total service.
Now, as far as a
So-
long-term disability, and I would sort of view that as like a disability retirement, is that something that the fund offers?
The fund does have a disability pension aspect. There's some criteria you would have to meet. You'd have to be totally and permanently disabled. You'd have to have an award from the Social Security Administration stating that you're totally and permanently disabled. And then you'll be eligible. And if you had 10 years, if you were active in the plan 10 years prior to onset of your disability, and you'd be eligible for a pension.
Okay, thank you. So just
Then-
major qualification though, you have to have a Social Security disability award.
Correct.
All right, there's other boxes you have to check, but that's the big
That's
one
the
right
big one.
there. Dave, I'm going to turn it over to you now. Can you explain, and I think there is some confusion when it comes to the union as far as reciprocals. All right, so how the benefit funds are still a little bit separate at this point, not all of them are merged. And what if one of our members works in Pittsburgh? How would that reciprocal work? What would the member need to do to get those hours to come back to the fund office?
Absolutely. So as far as reciprocals are concerned, our council, the Eastern Atlantic States Regional Council of Carpenters, is quite large. We know that it covers all of Pennsylvania, all of New Jersey, Pennsylvania, Delaware, and Maryland, Virginia. However, the EAS funds, we only cover Eastern Pennsylvania, New Jersey, and Delaware. So if a carpenter is working in Pittsburgh, they will have to fill out a reciprocal form for those hours. Same thing with New York City, or same thing if they're working, let's say, in DC. Now, once you fill out a reciprocal form, and you can do that right online under the hours department, reciprocal form, submit a reciprocal form. Once you fill it out for Pittsburgh, that's good for your lifetime as a carpenter. Once you submit one for New York City, that's also good for you for New York City. If you travel to California or Mississippi, you'll have to fill out another one for those areas. I know it can get confusing knowing whether it's an outside fund or not. Lean on us. We're here to serve you. Call the collections department, email us. We'll walk you through. And if you're our participant, if you're joining this webinar, you fill out the reciprocal form with us, and then we forward it to that outside fund to make sure those hours can't come back. Similar to collections with benefits for old benefits, don't wait too long. If you're trying to reciprocate hours that are 10 years old, some of those funds may not reciprocate those hours. So please try to do it within the year of working so that we make sure those benefits come back and they're accruing your pension, they're increasing the amounts in your annuity, and you're getting all the credit in health and welfare and every single fund that you
And
work
you
for.
can submit the form online, Dave, correct?
Yes,
All
right there under hours department, you'll see reciprocal forms, and one of the buttons is submit a reciprocal form. You will log in. It'll be a form you fill out online, and you can submit that You can mail one in, or again, you can even email one over to us. We'll help you out with that.
Okay. Heather, I'm going to ask you a question now. Is the retiree coverage the same as the active coverage?
So early retiree coverage is the same. It is the same as the gold package that we offer the members. So it's still independence administrators, 90/10, Express Scripts for your prescriptions. And then for the dental and vision Legacy Philadelphia members have that already. Legacy New Jersey have to enroll in the dental vision for an additional premium each month per person.
Okay. And as far as the premiums that come out for the retirement, the co-payments, as Eric alluded to earlier, is that something they need to send a check for, or does that money get pulled directly from their pension?
It'll be directly deducted from your pension check.
So it's
each month.
seamless. You sign up for it, it comes out. You don't have to worry about
Correct.
sending a check in each month. We already take care of that. What happens when I go to, can you explain the transfer of going from active coverage to Medicare and what we would need from the participant on that?
So we send a letter about 90 days prior to your 65th birthday, if you're a retiree, letting you know that we are going to be looking out for your Medicare card. So if you have that, you can send it directly into our office. You can email it in. You can upload it on our website. You can mail it in. Once we receive that, we will enroll you in our Medicare plan. It's through Blue Medicare Advantage. As long as you see an in-network provider and it's a Medicare covered services, they are covered at 100%. So that is an option for the membership.
Okay. So it's pretty seamless too.
Pretty seamless. Just mail your Medicare
we
card.
handle all that 90% of that weightlifting. We just need
Yes.
that card that say that they have on Medicare. And do they have to take Medicare Part A and Part B?
Correct. If you are not working and you don't have any active employer-sponsored health insurance, either through yourself or a spouse, make sure you're enrolled in Part B. Once you get your card, send it in to us, and we'll do all the enrollment for you.
Okay, great. This is a good segue too about death benefits. What kind of death benefits does the fund offer for an active participant? Unfortunately, if you're not retired and you pass away, what we talked about how important it is to have a beneficiary on file. What would the beneficiary be entitled to? And we'll start on the active side. Heather, can you take that?
For the active health death benefit, there is a $35,000 benefit that will be named to your beneficiary. That will go to your beneficiary. I'm sorry. The health fund, you can name anybody your beneficiary. You don't have to name a spouse. So you can name your child. You can name a charity. You can name an estate, your estate. But the health fund, you can name anybody.
Okay. And what would happen to the HRA?
The HRA will go to your eligible dependents that are currently on our system. So if you have children under the age of 26 or a spouse, they will be able to continue to use the HRA card.
And if that unfortunately happens, how long would the spouse and the children be able to stay on the coverage?
So for an active member, the spouse and eligible dependents are eligible from 1 year from the date of death at no cost. And then after that, they would be eligible for COBRA for 36 months.
Okay. All right, great. Eric, how would that impact the retirement side of things? What would get paid out to the beneficiaries in the event that happens?
On the retirement side, if he's an active participant, the death benefit for a single person would be 60 guaranteed payments to their beneficiary on file, all payable in a lump sum. For a married participant, they have the option of either the 60 lump sum payments, or they can choose the 50% joint survivor payment for their lifetime, for the spouse's lifetime. Now, I think healthcare-wise, the retirees, the spouse gets the coverage for 12 months at the current copay rate. After the 12 months, they have the option to continue the coverage just for the spouse's lifetime.
For her lifetime, correct?
At the current, I don't want to say COBRA rate, but it's the COBRA rate.
Whatever the cost of the coverage
Whatever
is,
the cost of the coverage is.
they can continue to stay on those benefits if they'd like.
And there's I'm sorry.
No, go ahead.
And there's a 10,000 lump sum death benefit for active retirees
From the pension side.
from the pension side.
Okay, thank you. We're getting the questions are still coming in, so we don't have that much time left, but we're going to be wrapping it up soon. So please, thank you again for everyone who's stuck with us tonight. If we didn't get to your question, I'll be hopeful I can get there. With that being said, where we talked about death benefits, Eric. I'm just trying to go through these questions as they're coming in. Can can you talk about, again, we talked about the importance of retirement planning. Can you just reiterate how important that is,
Sure.
Eric?
Yeah. It's good to have a plan when you're looking to retire. And I strongly emphasize meeting with multiple financial advisors, only because they're all going to have different options. They're all going to have different ways of getting you to the finish line at retirement.
Here's a follow-up
And-
here, because we were talking about retirement planning, because a chat just came in. What can I do with my annuity money when I retire? Do I have to take it out, or can I leave it here?
For the annuity money, if it's the current EAS profit sharing, you can leave in the fund, and you will still be subject to the interest each year. And you can just leave it here. You can take it as monthly payments, or you can take a lump sum. The legacy Philadelphia annuity, you must withdraw when you retire. And then your two options are either take a lump sum payment that could be taxed, or a lump sum you can roll it over to another investment fund, or you could take it as a monthly payment spread out anywhere from 1 to 15 years.
Okay. And again, we're going to reiterate the retirement planning, because these are all things you should be going over
Right.
with your financial planner to make sure you have that plan in place. All right. Okay. All right. The questions have really slowed down right now. It's 6:12. We've been taking questions now for close to 42 minutes here. Dave, I'm gonna wrap it up as we're going. And if any lingering questions come in, but I'd like to just get your take on, from your side of things, what's one of the most important things from a benefit standpoint you would like to talk to and reference to the membership?
Sure. So I say it all the time. Please just check your hours, check your hours, check your hours. Your hours drive everything. All those wonderful health benefits, all those wonderful retirement benefits. If the employer is not paying all the hours that you are working for so hard, they're literally taking money out of your pocket. So please save your stubs, log into my profile, make sure that the employer has paid all the hours. And if not, if you're having any trouble, the employer isn't returning your phone call, call us, lean on us. We have a team of collection specialists. We'll call them. Again, we'll seek legal action. We'll make sure that those hours come in. So please don't put yourself in that situation where benefits are unpaid. Check your hours.
Thank you. Thank you, Dave. Check your hours, check your hours, check your hours.
Yes, sir.
Dave says that in his sleep all the time. I'm going to turn it over to Heather. Heather, same question as far as what should be their lasting impression if they're going to take one thing away from tonight?
I think there's two things major in the medical department. Always check our website, go to the health benefits page. We're constantly launching new vendors for you guys. So definitely always check that. And then please always update your beneficiary after every life-changing event. It's very, very important for us.
Okay. Eric, same question.
To be prepared. When you're ready for retirement, just have all your ducks in a row. There's going to be a lot coming at you. You're going to have to make choices that you can't change, that you're going to have to live with for your lifetime. So just be prepared.
Be prepared. And again, we can't stress how important it is to meet with a financial planner. You know, you built these benefits over for a long time, usually a 25, 30-year career. So there's a lot of money that you're dealing with here on the table that we're managing for you. You know, if you don't know what to do with that, there's professionals in place that can help you manage that money and give you guidance on what you're going to do. So again, we're very good about retirement awareness. We're trying to push that to you to make sure that you're prepared when you come in to retire. And if I'm going to ask that same question to myself, is to just know your benefits. That's one thing I want you to come out of here tonight, is just to know your benefits. Find out what's important to you and try to hone in on understanding how those benefits are going to work directly for you. If you're coming up for retirement, please plan. If you went through, unfortunately, life changes, check your beneficiary and make sure your beneficiary information is up to date. And if you think you're missing hours or have any questions about your hours, just make sure you contact our collections department so they can aggressively look and find out if you are missing hours and the reason for it, and hopefully capture those hours and get them there. But one thing I didn't touch upon, because it didn't come up on the chat, was that, just to reiterate, that we do have, and Heather, before we wrap up here, we do have fund nurses. Can you explain what the fund nurses do for our membership? Because it kind of falls under the healthcare side of things, and how they can help our membership.
Absolutely. We have 3 fund nurses available. They are from Temple. So one works in our office. You may get a call from her if you're recently in the hospital or if maybe a pre-cert was done on your behalf. And then we have 2 mobile nurses. Those nurses can go to doctor's appointments with you. If you have any questions, they can come out to your house. Those nurses are available to you guys.
Yeah, and we referenced that they're affiliated with Temple Health, but you don't have to be a Temple patient to see the nurses. They can see anybody. If you have any questions, they might just call you directly, and because they know that you possibly were in the hospital recently, just to check in on you. So it's a great benefit to have. If you have any questions, again, you can find all this information. A lot of the information that we talked about tonight is on our website. So we're trying to make sure people understand that the information's out there. This is the first time we're doing this live Q&A. We hope to make this maybe a bi-yearly thing, depending on if we get traction on it. We love getting in front and engaging with the membership, answering any questions that are out there. As we wrap up here, anybody have any last thoughts that they want to discuss? All right. Well, thank you to the panel. I thought it was very informative. We had a lot of great questions come in. I want to thank you to the people that joined the webinar tonight, and thank you and have a good night.